Hello, my name is Benjamin Juan, and I am working in the Arizona Emergency Medicine Research Center. The device I am working with is the ROX3. It is a retinal oximeter, or ROX for short, and this device is currently the third generation of the original retinal oximeter. And this is what it looks like. The ROX3 should allow anybody who uses it to measure non-invasively the oxygen saturation of the exposed vessels of the eye. The retinal oximeter uses several very low intense lasers, and what it does is it shines them into the eye over the structures of the vessels in the retina, and what we get back is reflected laser light that we then measure when it returns. And what essentially happens is the densities of the lasers when they return have been changed from when they originally entered by the structures within the eye. Oxygen saturation is it's a pretty good indicator of what's going on in our blood. All our organs require oxygen to function properly, and if somebody, say, were injured, like in trauma, if they were bleeding internally, the person who's treating them wouldn't easily be able to tell that. So using a retinal oximeter, they will be able to detect blood loss when there is obviously no sign of it. Today in the emergency department and across the hospital, many of us have seen the device that we use today. It's called the pulse oximeter. And what it is usually slipped over the finger. It shines a light through the nail bed, and what it gives a doctor is the oxygen saturation of the blood, when in reality what it is giving is a hemoglobin saturation. And in the case of carbon monoxide poisoning, what the indicator would show is that we have great saturation in our blood, when in reality our cells are being starved of oxygen. So in essence, our device, which is based solely on oxygen, would be able to give a more accurate reading. As a result, patients can be properly triaged not only by observation and questioning, but by their blood oxygen saturation. The future of retinal oximetry, in our minds, is that the device will be smaller and more maneuverable, and maybe one day would be this big. This is an ophthalmoscope. Is used in all hospitals today, and one day we're hoping that this will be the size of the retinal oximeter that doctors could use.